Well, good morning and welcome back. 8:26 right now, your news time. In KHQMD this morning, Washington State having one of the worst whooping cough outbreaks in decades. Already this year, 18 cases have been reported in Spokane, which may not sound like a whole lot, but until you hear this, in the same time frame last year, only one case was reported. Right now, Kelsey Watts joins us with a member of the health department to tell us how you can prevent the spread of whooping cough. Kelsey?
Thanks, Blake. Yeah, Kim Papich is here from the Spokane Regional Health District, and Kim and I met earlier this week actually doing a story on this epidemic. And we know that it kind of started out in the western part of the state, and now we're seeing it here more locally. And you're offering a clinic today to help protect the spread. Tell me about that.
Right. Governor Gregoire got an additional allocation of 27,000 doses for Washington State of whooping cough vaccine. And so Spokane's allocation for this first clinic is going to be about 1,000 doses. And we're going to have a clinic from 9 to 1 today. And we would like to vaccinate as many adults over the age of 19 as we can.
Okay, perfect. Because the concern here was, we were talking earlier, obviously children and babies are more at risk for this disease, but it may be the adults in their lives who are carrying it and then passing it on to their children.
Right. Babies can't be fully immunized until after 1 year old, and they still are working on getting additional immunity. And so we need all of the adults and grandparents and caregivers that are in those babies' lives to get their Tdap vaccination, and that's going to help us protect those babies.
So for somebody who's maybe had the Tdap vaccine before, do you need a booster?
As an adult, you need to get the vaccination one time.
Okay.
So
if you've had it once, you're set to go. But if you haven't had it, this vaccine clinic is happening from 9 a.m. this morning till 1.
Yep, over at the health district. Plenty of free parking and pre-filled syringes, so we should be able to take any walk-ins and get them through quickly.
Okay, and these are for people who don't have insurance, too.
True.
Okay, perfect. Yep. So anybody, head on down there if you don't have insurance. Get yourself protected this morning over at the health department. We'll be back right after this.